Well, thanks for sticking around with us. Antinuclear antibody testing, also known as ANA testing, is a comprehensive approach to diagnosing autoimmune disorders. Here in the studio to tell us more is Dr. Beth Lindsey with Singing River Health System. Thank you so much for being here.
Thank you for having me.
Awesome. So this is basically a test so you're able to detect autoimmune disorders, right?
Correct. So an antinuclear antibody, or an ANA, is a commonly used test to kind of open the door for screening for potential autoimmune disease. Having a positive ANA test does not automatically mean that there's something wrong.
Yeah.
It just means we need to take a closer look from a rheumatology standpoint, get a little more medical history and some more in-depth testing to determine if there's something there that needs to be treated.
All right, so kind of just tell me about the symptoms prior to testing, why you guys are needing to perform this test.
Sure. So commonly seen symptoms that lead to ANA testing are often unexplained fatigue, joint pain with swelling, rashes, or other chronic symptoms that maybe we haven't quite figured out why that's going on.
All right, so kind of just tell me behind this testing, what are the outcomes in terms of the disorders or the diseases that comes out of it?
So an ANA test on its own does not automatically diagnose disease, as I mentioned, but we get more information not only through our history and physical exam, but through additional blood tests to determine if there could be an autoimmune disease. These are a number of diseases that your immune system attacks the body. Common examples include rheumatoid arthritis or lupus. So our job from a rheumatology standpoint is to see, do you have these or can we rule that out?
Awesome. So what does the evaluation process look like?
So we start with a visit in our clinic where you sit down with myself or one of our other rheumatologists, and we ask a lot of questions, really detailed questions, trying to get an idea of your symptoms, how long the symptoms have been going on, and that helps us tailor what other specific testing needs to be performed to either rule out or diagnose an autoimmune disease.
All right, and I know you mentioned just because there is a positive test doesn't necessarily mean that you have this disorder
Correct.
or disease, but once they're diagnosed, then what is the process after that?
If we do additional testing and lead to a diagnosis of a particular rheumatic disease, then you'll continue to follow up in our clinic and we'll go over detailed information about treatment options and long-term prognosis.
All right, and you would basically say this is a proactive approach, right?
Yes. So we want to make sure that you're getting your symptoms checked out and that we're ruling out the potential for a lifelong disease. We want to make sure nothing's being missed or overlooked. So that if we do make a diagnosis, we're able to catch that early and get it treated appropriately.
And lastly, I do want to ask this, is there an age gap or a specific age group that this is probably reaching to?
Not necessarily. We see patients of all ages. Autoimmune disease can occur from childhood through the elderly population, so there's not really an age cutoff there.
All right, awesome. Well, I believe that's it. Thank you so much,
Yes,
Dr. Lindsey, for joining us.
Thank you for having me.
Awesome. All right, so looking ahead to